here to talk about the issues that matter to your health. The Crooze Doctor on 91.2 Crooze FM. Great music.
Great music.
Great friends.
Great friends.
A very good evening. Welcome to the Crooze Doctor. My name is Mr. Woods. And of course, in studio, I have Doctor himself, the expert, of course, on health matters. And that's Dr. Brian Besiga. And of course, today we've got a great topic that we're going to speak about. I know I say great in the sense that it's of concern to everybody, the community, to family, and also to you as an individual. And just in case you know somebody, a friend, or somebody that could benefit from what's going to be discussed today, I believe the knowledge that we're going to get from today's discussion, of course, with Dr. Brian Besiga will be of help. We're going to be discussing the health effects of smoking. And, of course, Doctor, as an icebreaker for us who are not medical people, many times when we see people smoking in the movies or maybe at parties, social events and stuff like that, it makes smoking look cool, like the guy that's smoking in the movie, he's the bad guy. But then also looking around hangouts where people go, people that smoke, there's this perception that, oh, that guy's cool. Or maybe they're paid to smoking a cigar and stuff like that. But anyhow, many of us do not actually know that the dangers of smoking definitely can be, very devastating. I think if I checked out the World Health Organization report, they say about 8 million. You will be able to confirm some of these cases. Figures as well as, the information, wealth of information you're going to share here regarding smoking. I think it says about 8 million, you correct me, people have suffered or suffer smoking-related, deaths, that is. But to get us started, of course, with today's discussion, I want to, in the interest of time, for us to just get straight to some of the questions I have on my mind. Of course, I'll put 3 questions to you to open up the discussion. And to this, I would want to ask, if I'm to start with, what a cigarette, of course, what exactly is a cigarette? Because I mentioned cigars and cigarettes, we see people smoking. Some even do shisha. I just need you in your wisdom to help us understand what it is. And then, of course, why it's harmful. And maybe to even use the word, to mention the words tobacco in this, because it usually, is the ingredient used in cigarettes. And of course, maybe also what happens to the body when we smoke cigarettes. And then maybe lastly, you definitely will talk about the damage, the effects it has on our body and the different body parts. I've thrown those 3 questions. And Doctor, you're welcome to the show, and you take it away from there.
All right. Thank you very much, Mr. Woods. Thank you for having me. Sorry, it's a pleasure to be here to indeed talk about matters that matter to our health. Today we've talked about things that I think probably affect either us directly or people around us.
Yes.
Last time we spoke about alcohol and how dangerous it is. And today we are talking about smoking, okuresa. Okuresa. And of course we'll mostly talk about smoking tobacco, but really it applies to smoking any kinds of things. Okay. Marijuana, shisha, cigars, all those are included in this. So kuresa things akugamba omunonga abantu bingi mbakumanya. We know, I think we probably know what smoking is, but basically it is oculating plant extracted tobacco, and then you inhale it. You inhale that smoke. Yes. It is strange, but I think as we'll see some of the reasons why people smoke. Smoking is very dangerous for our health. As you've mentioned, over 8 million people worldwide who suffer from smoking-related death. Per year. That is, I have to say, this is per year. It's not like over a period of time. Every year. If you translated that into days, you'll find over hundreds of people dying every day because of smoking related complications. So why do people smoke? I mean, I think it's always a question. I remember when I was younger, I used to ask someone I used to stay with who used to smoke, and I used to ask him, "Why do you smoke? What do you see in smoking?" Of course, he pushed back and said, "Okay, why do you drink water?" But I think it's different. But I think what he was just trying to show is that it's like when you start, you just can't stop. It is just like you have a craving for water when you're thirsty. For them, they have that craving for smoking. Or on a number of occasions, you'll find that they need to smoke in order to relax. When they're feeling anxious, they need to smoke. When they're having many problems, they need to smoke, you know. And of course, there are other things that, people will eventually go into when they begin smoking. And the reason for that is the substances in the cigarettes or in the in tobacco, for example. They cause addiction. They go straight into our brain, and they cause you to be addicted, to have these cravings, so that every time, morning, evening, you want to smoke, literally to move. It's like it becomes like your fuel, literally. Without it, you can't do anything. Without it, you're tensed, you're anxious, you know. But we know, in fact, I actually don't know the health benefits of smoking, unfortunately. And so it goes on to show you that if to be a politics, if it wasn't for the politics in this world, I think we wouldn't be having any industries or factories that manufacture cigarettes. But because you'll find most of those, they are big corporations, big industries, big names, and so they have connections. They are connected to the people who drive the agenda in this world. And so it will be hard to eliminate them, or it is hard to eliminate them. Instead, what they've successfully done is just to try and make sure that you have a clear message that smoking is harmful to your health. Body. I think now on every cigarette we have that message,
a disclaimer.
So isn't it interesting that you read and say, "Oh, this cigarette is actually harmful to your health." Yet people go ahead and do it.
Indemnity, like you take full responsibility for your action.
It really takes someone who is addicted to do that. But how do people begin to smoke? One is most people begin smoking around adolescence.
Okay, Doctor, I beg, let's just go in for a quick break, and then that point, when do most people begin to smoke? And I like the fact that you mentioned adolescent. We will return, and from that point, you will take it on. We have Dr. Brian Bechiga in studios. This is the Crooze Doctor, and we're discussing health matters, the health effect of smoking. We'll return in a minute.
91.2 Crooze FM. Great music.
Great music.
Great friends.
Great friends.
Very good evening. It's 26 minutes past that 7 p.m. And of course, in studio, I've got Dr. Brian Besiga. And hey, we're discussing health matters. And today's topic, very interesting. We're discussing the health effects of smoking. And Doctor, just before we went on the break, you were speaking about the stages when it's most common for individuals to be introduced to smoking. And I want you to just get back on that note and continue to help us understand smoking and the health effects on the bodies. Please.
All right. Thank you very much. So we've said smoking most of the time starts around teenagehood, okay, adolescence. Of course, it could start younger because we know that when you have babies, they like imitating. What they see you do, they will do. If they see someone smoking, the next day they'll want to smoke. In fact, while we say, about 2.4% smoke, if you went and asked people, adults, who have ever smoked, smoking of any kind, you'll be surprised. It might go up to 80% plus. So they will smoke a few things. I remember when I was younger, I would get spear grass. You know spear grass? It has a hole and you could light it and you suck and there is that smoke that is coming. And we do that. I want to say that, by the way, these effects, as we'll see, the health effects are not just about tobacco. It is anything you smoke. Even that kind of smoking was dangerous, and we'll talk more about it.
Doctor, can I just throw this in? Marijuana, yes. Because now marijuana, that's common
yes,
as well.
So we've said smoking, cigarettes. That's tobacco. Shisha. I think we have a number of people going out to clubs and smoking shisha feels cool, but you need to know that it has
health effects.
Health effects, yes. Marijuana, heroin. People smoke all sorts of things, and they're very dangerous for our health. So I was saying, during adolescence, this is a time when people are having bodily changes. They are feeling like they feel like they are growing into adulthood. They're having some degree of freedom. The parents will give, they are going into high school, university, and the parents are giving them some money for upkeep, not for smoking, but for upkeep. They can go out to clubs, they can, so they have, and then, as you said, they have access to computers to watch movies the way they like, as they wish. And so they will see this person, maybe it's like a movie star, smoking, and it feels cool. Or others will just say, what do people like in this thing? And then they just smoke once and then twice. Before long, they can't stop. The other thing is when you have peer groups, you would have this peer pressure. You go out to a club, everyone is drinking, and then you are the uncool one if you're not drinking. Everyone is smoking, you're the one who is uncool.
You want to fit in.
And guess what? The other issue with adolescents, you'll see your friends who smoke seem to be the ones hanging out with the bad girls. And then you feel left out. You think smoking is the only way you can you can fit in the group. So all those make people to initiate smoking. And remember, even with alcohol, the way we said that you can have 5 people start drinking and 2 of them can become addicts, the others become social drinkers. Same thing with smoking, that you can have 10 people initiate, 5 or 6 quit, the others remain addicts. So then that means the best way to prevent yourself, to make sure to quit smoking, is actually to never start.
True.
Okay, never start smoking, because you don't know. You might say, let me just have 2 puffs and then I'll stop there. And before long, you're addicted to smoking and you can't do anything without smoking. Now, the challenge with smoking is this, and as I said, any form of smoking, it has health effects, it literally affects any part, almost all parts of our body in one way or the other.
Yep.
And we'll talk more about that. But the other biggest problem is that when you're smoking, even people who take in second-hand smoke, they've not got the cigarette to smoke it.
Yes.
But they're having the smoke from you. They have almost as much effects
Yes.
as the person who is actually smoking. What does that mean? If you're a dad, you're a father there, you're smoking, know that smoking is affecting your child. We talked sometime about pneumonias, these lung infections in kids.
Yes.
If you have parents who smoke, very, very high risk for the kids to get pneumonias. So that's like the biggest problem. Now, we know traditionally, this tobacco, for example, has nicotine. But you have the other products like tar.
Yes.
You remember tar?
Yes.
This is when tobacco is improperly burnt.
And in the leafy form.
Improperly burnt, or even in the leafy form.
Yeah.
But you also have other things that happen. Like, for example, you get some degree of carbon monoxide. As we know that incomplete combustion or incomplete burning of oxygen produces carbon monoxide.
Yes.
You will have things like hydrogen cyanide, all those in that smoking. Now, the incomplete burning, that one happens even if you use, I don't know, whatever you use to smoke. The spear grass that I was talking about, that we used to use when we were younger.
Yes.
Those alone, you have some incomplete combustion. You could actually get carbon monoxide poisoning as a result of that kind of smoking. Yeah. So this tar, it is a heavy substance. What it does, it stains for it. It like stains almost everything. If you see someone,
it stains word because like what?
If you
internal
see,
organs.
Yes, wherever it goes.
Okay.
Let's start with the teeth.
Yes.
If you see someone who has been smoking for a while or for long, their teeth will be stained. They're likely to be yellow.
Yes.
Yellow teeth.
Yeah.
Okay. If you look at their nails, they will be stained. They will not be the normal nails.
Yeah.
Okay. If you look at their tongue, if you look at their gums, all those are likely to be stained. But now those are the things that we are able to see physically. But as I said, it stains wherever it goes. So even your airway, if we were to cut it out, your throat, all the way to the lungs, we'll find that they look different. Even the lungs themselves. And if you are such a heavy smoker, even your blood vessels might look different from someone else because of that tar. Now, it doesn't just do that. It also destroys our their hairs in our airway. Those hairs, we call them cilia. Those hairs are supposed to trap particles, especially the large ones, which escape into our airway. And then as they beat, it's like a conveyor. Remember we talked about conveyor belt. They push them out,
Yes.
They're oriented to push them out. So this tar and hydrogen cyanide will destroy those hairs. So if they are destroyed, what does that mean? It means anything
can escape.
And that is why people who smoke are at a very high risk of lung infections. Because bacteria can easily go through viruses, and they have those. This tar, it affects your neurons in the nose, in the mouth. So people who smoke over time are likely to lose their sense of taste, sense of smell. And sense of taste, it means that people will be eating food. They say this is yummy.
No tasty. You just like you think, just give me. Let me finish it for you.
Just eating
anything.
Exactly. Whoa. Now, when it goes to the lungs, remember it will blow up into this is all this nicotine and tar and in form of smoke. It will get into your lungs, fill them up, and some of them can develop like emphysema. Basically enlarge and they cannot relax. Remember, the air sacs, our air sacs in the lungs, which we call the alveoli, are supposed to relax, okay, thereby expanding or contract to push out air. So if you find that they are persistently enlarged, they do not contract, then that is where they trap air. And this air could be carbon dioxide, for example. And so you see how it is affecting your air exchange at that level. COPD is one very common thing that people who smoke face. COPD, this is a chronic obstructive pulmonary disease. But I think I may not just go into the details, but the biggest characteristic is the cough, chronic cough. I think now maybe I just want to say that as these substances destroy your airway, you could have coughing. So people who smoke will normally cough a lot. I think we know that. We've seen it.
Yes.
People who cough who smoke are usually coughing.
Yes.
However, there is this chronic cough that happens associated with some, difficulty in breathing, or you feel like you have air trapped, or even sometimes you get easily fatigued as you walk. So that when those happen, most likely someone has gone into that COPD that I'm talking about.
Okay.
The lungs themselves could become stiff. Let me call it stiff, fibrosed, so that now they are no longer compliant to the air that enters. Now the smoke, these substances don't stop at your lungs. They enter your blood.
Okay.
And when they enter your bloodstream, they make your vessels brittle.
So stiff. Brittle means what? Stiff.
Stiff. Okay. They make them stiff.
Yep.
Remember, our vessels are supposed to remain compliant so that they're able to relax and expand, depending on the pressure that is coming from the blood coming from the heart. Okay. Now, when they are stiff, so the challenge is that it stiffens them and narrows them at the same time. So if it is in some vessels where it causes complete narrowing, then that is why you get things like heart attack, okay, as a result of the smoking. Or you could even get clots because there are substances that are not supposed to come. They are usually supposed to be kept in the center, so that when the clotting substances are supposed to be kept in the center, so that now when they come close to the wall of the vessel, then now they will stimulate clotting, and you can develop clots as a result. So you see how smoking can lead to all that.
Yes.
If it destroys vessels that lead to things like the kidneys, then it means that someone could end up getting kidney disease as a result. If they destroy the vessels that go to the penis,
fertility then.
Fertility issues, because people are likely to get erectile dysfunction.
And how
for
about
women,
for the women?
For the women, it goes up to the uterus and can cause miscarriages. It can can have effects on the baby that is being born. Which part does it not go to?
The one, you remember you mentioned the neurons, and then I was waiting to hear the brain.
The brain, yes. The brain is affected. Remember, of course, we've said the way that people get addicted is the effect of these substances of addiction on your brain.
On your brain.
They affect different parts of your brain, so that you cannot live without smoking. But it will also cause things like affect some parts and end up leading to anxiety, depression, as a result of this smoke. And then the big one is smoking and cancer.
Okay, give us the link. The link between smoking and cancer.
I think we can talk about. So the cancers, of course, we talked about.
And possibly which types.
Yes, we talked about how cancers develop, right? We said there are a number of mechanisms. One is you could have damage damage to cells, okay?
Yep.
And then you have misrepair of those cells. When they're damaged, they're supposed to be repaired in a certain way. But if you have misrepair, then it could eventually lead to this uncontrolled growth, which is the cancer. And we know
So misrepair,
most of the places.
Doctor, misrepair, just remind us what's
I think we can just think about like any repair, like your car breaks down, you take it for repair, or a bicycle breaks down, you take it for repair.
Yeah.
It's like misrepair would mean that if the mechanic was supposed to put one nut, they put two, or they don't put it at the end. Do you get my point?
True.
So even our body is like that, because we routinely get insults to our cells, and the body cells are supposed to repair in a certain way. And that is why most of the parts where you have continuous insult, then you find those parts can develop cancer. Like you can get if you find that you constantly get wounds all the time, you could actually get a cancer because of that. You get. And then of course you also said that depending on the cells, sometimes they will want to change so that they can handle the smoke. This smoke is typically can try to be managed by columnar cells. So certain cells may not be able to handle actually not columnar, stratified squamous cells, Anyway, but just I think the most important to note is that smoking causes many cancers.
True.
The way I've described smoking, go up to your lungs, think about any cancer in that area, and it will be caused by it. It will be either caused or common in people who smoke.
Okay.
Talk about throat cancer, talk about cancer of the tube that goes up to the stomach, the esophagus. Talk about the lung. I think the lung, for it, we've actually established causation.
Yep.
It's not like it is known that these substances cause lung cancer.
Okay.
Cancer of the abdomen, cancer of the bladder, of the colon, of the rectum. So I think it causes a million.
Okay, so if I'm to get to my next question, Doctor,
however, the commonest ones are lung cancer and the throat, the throat cancers. Those are ones where people who smoke are very, very much likely to get compared to people who don't.
Okay.
Yes.
Okay, thank you so much. Doctor, maybe I know you've spoken about, the symptoms, of course, like this, you've given examples of, symptoms that can end up being seen. Are there any other, or I know you mentioned also the coughing, but there's usually stubborn cough, like chronic cough that, just does not easily heal. Okay, I'm trying to put myself in the shoes of a listener out there who possibly might have certain signs that we may not have mentioned that the person can, needs to already, if they're in the habit of smoking, if they see these signs, is it the yellow nails, fingernails you spoke about, the yellow teeth? Should that worry them that, okay, I think I must go see a doctor because my toenails, my fingernails, my, cough is just chronic, stubborn, it's just not going away? Those visible signs, are they already concerned for me to come see a doctor, as besides even stopping smoking?
Yeah, thank you very much. Of course, the unfortunate bit is that these symptoms develop over time. So if you were to wait for them to develop, for you to be able to see that doctor or to attempt to quit, I think it would be very late. At least, well, of course, we know that even post-smoking, some people still have effects.
Okay.
The lungs, for example, can try to heal when you quit smoking. But there are some which might be damaged, so that even 10 years, 20 years post your smoking, you could still have effects due to that smoking where, which you stopped 10 years ago or even more.
It had done the damage. Doctor,
exactly.
Then on
so I think we've really mentioned. I think for alcohol, yes, we know it's bad, but there are a few things you can say. Okay, alcohol, but for smoking, I literally don't know any health benefit.
Okay.
Of smoking, and apart from the benefits that the people who are addicted think they get. Do you get? You ask someone who is smoking, they will tell you, oh, when I smoke, I feel like this. I smoke, but it is because they are addicted.
Yes.
But short of that, we don't have. So if you're out there and you're smoking, the day to quit is today, not tomorrow, not the other day. Although, of course, we know that it's not easy, right?
No.
We talked about addiction, that people will say, I've stopped.
Yeah.
And then in the evening, they are doing the same thing. That's addiction.
Seeing a doctor
so
begins
it's not
the process.
Easy.
Seeing the doctor
Well,
begins the process.
some people quit right away. By the way, when we're in hospitals, we've seen people, they'll say for them, they cannot quit alcohol. And then the day you tell them that you're having this liver disease as a result of alcohol, that's the day they stop.
And that's what
I'm
saying.
It was like the other time it was extremely hard for them, but now when you tell them that this
your life
disease
depends on it,
which is about to send you to your grave, is because of alcohol, they stop. And same thing, people won't quit, but the moment you tell them that you have lung cancer, and it's because of your smoking, that's the day they say goodbye.
Okay.
But the unfortunate bit is
might be too
it's too late, right? It is too late to do that. So anyway, I was saying that I think it is good to have the initiative to want to quit.
Yes.
And then now you can ask a healthcare provider how you can quit.
Yes.
We do some what we call nicotine substitution therapy.
Yes.
Like instead of smoking, we give you some something to chew on so that it gives you a feeling that you've smoked, yet it is harmless. It's pure and harmless. Okay.
Yeah.
But even that, it is just to take you on a journey of eventually quitting smoking. It's not like we are saying have this for the rest of your life.
Yeah.
And then there's also some drugs we don't routinely use them, and they may not be readily available. But also, just talking with someone, with a healthcare provider, with a psychologist about your desire to quit smoking could make that difference. Because I think we said there needs to be a will.
Yes.
A will to stop.
Yep, to stop
smoking or to quit. Yes.
Doctor, I'm itching before we get out of here, because I know time is definitely first running. The issue of passive smokers. When we were starting here, we just spoke about children and pregnant women, because of course the children see what parents are doing. But here is the situation where we want to find out, doctor, from you, how secondhand smoking, of course I remember passive smoking be mentioned, or when people smoke around you, you too who's not directly in the act can get affected. I want you to just quickly, in maybe a minute or two, of course, talk about, what secondhand smoking or how harmful secondhand smoking is. In this case, we're looking at children. I'm looking at the family. Maybe even include friends in your response. And then maybe if someone has a wife, they don't have to be pregnant, but maybe if they're even pregnant, we could still benefit from, the wise, counsel from the doctor in regards to passive smoking. Go ahead.
Yeah, thank you very much. Of course, we mentioned that second-hand smoke is as bad as first-hand.
Yes.
Okay. You might say, okay, I'm not the one, making that puff, but you're also as affected as the person who is smoking.
Yeah.
And so because of that, that is why it is very important to not smoke in public. I think there are places already
designated
which have taken steps in public places, you won't smoke from there. It's not allowed. See how smoking can be extremely
isolated.
Like they isolate you. They say if you must smoke, go the other side. But people will go. Some people go to the toilets to smoke. Anyway, as I said, that is what addiction can do. Yeah, but it is not really just the children or the pregnant women. In fact, if you have a friend you hang out with, they are smoking all the time, you're also smoking in a way.
So
you're indirectly smoking.
Pull back, move away from that.
So yeah, I think the first step is to make sure that when they're smoking, you're not near them.
True.
But also to advise them to take steps to quit smoking. Plus, smoking destroys our environment, right?
Yes, it does. It does very much. So, doctor,
yes.
Can I get cancer being a passive smoker, just hanging around somebody
Yes,
that smokes?
Exactly.
Can I get that chronic cough?
Exactly.
And then that means I can also suffer the same consequences like
Same
I'm actively
consequences
smoking.
like an active smoker.
Okay. So, doctor, and then in 1 minute, because I want to take phone lines for you, the phone calls, so you can be able to respond to that. If someone was to quit smoking, I'm imagining someone out there listening, okay, you kind of convinced me, but what will I benefit quitting smoking right now in 1 minute?
Yeah, so of course the quitting smoking, I think you don't look at the what can I say, direct benefit. You look at,
Yes.
I think you look at like the opportunity cost.
Okay.
Isn't it? Opportunity cost.
Yes.
Meaning what could happen to you if you continued smoking.
Yes.
So that when you quit, then it means that you've literally saved yourself from all these other consequences of smoking that you're talking about. You get.
Yes.
It's not like when you quit smoking, you'll get a trophy or you get a gift. But suddenly when you stop smoking, then you can know you've reduced your risk of cancer, you reduced your risk of heart diseases, reduced your risk of pulmonary diseases or lung diseases. You've reduced yourself the risk of
even harming your friends,
throat
family.
cancer. Yes, all those things. You've reduced that risk. So that is why it is extremely important. Okay,
so doctor, I want to give a chance to our listener to call in right about now. The line is 0752-912-912, 0780-912-910. Keep your question short, your name, question, and doctor will respond to your question. Crooze Doctor, good evening. Crooze Doctor, hello? Oh, okay. Well, we're happy that you're listening in. We can read a couple of messages that have come through. The phone lines are open, but we only have one question we'll take for now. Crooze Doctor.
A very good evening to Mr. Woods and Doctor.
Good evening. Your name and your question for Doctor.
This is Yasingo Diaz from Montara Gwenda.
Go ahead.
For me, I don't have a question, just I want some for the teaching the word.
You're welcome. Okay, Doctor, appreciate it for the wonderful job you've done. Okay, I'm trying to read some text messages in here that have come in on our socials. Of course, someone says from Katongole Bill, he says, I have seen some cases where smoking is given as a health advice. Doctor, could that be true? This is from Bill Katongole. And he said the doctors, of course, he's seen doctors also smoke once in a while. You will have something to say about that. And then, of course, we have a thank you from Alec Peaks. He says, thank you for the show. And then Alex Peaks as well, also says, I'm asking if there was burning smoke from any burning object like plastics, would it be considered smoking or not? If you understand this question.
Yes.
Okay.
Thank you very much. I think the person who says that he has seen some instances where smoking is recommended
by a doctor. Is there any such thing?
No.
So
I think
a lie.
That's
a joke.
That's a lie, and hopefully the doctor who any health worker who recommends that needs to be investigated.
They're not professional.
Yes. And then, of course, he said, I've seen doctors smoke. It is true that doctors smoke, just like they'll tell you, it's good to exercise and they won't exercise. They'll tell you it's not good to eat fat and they'll have their plate full of fats. Do you get my point?
Yes.
And the reason is that they are human beings and so they are not amenable to the things we're talking about.
True.
Doctors can get addicted,
Yes.
right? We've seen doctors who are addicted, say, to pethidine. This is like a pain drug.
Yes.
And they want to use it all the time.
Yes.
We've seen doctors addicted to betting.
Yes.
We've seen doctors addicted to alcohol.
Yes.
So this is an addiction. And you having the knowledge of this thing doesn't make you immune. I can tell you that you'll be surprised that the number of people who smoke know that it is harmful.
But they do it anyway.
But they will do it because they are addicted. Yeah?
Okay.
And then, of course, the last person who wondered whether the smoke from
burning plastic.
Yes, whether that would be considered as smoking. I think smoking, as we know it, that won't be considered smoking. But certainly it is also harmful.
Yes.
Because we said that as long as where there is smoke, even including the smoke from the exhaust engines, for example. I think I've heard of one incident where people used to think that inhaling that smoke from an exhaust pipe of a car is cool. And someone did it and they ended up in hospital. Admitted for over 2 weeks.
Whoa.
Because they got poisoned.
Okay.
As I said, the incomplete burning of oxygen produces carbon monoxide. This carbon monoxide has a very high affinity for our blood. When it goes there, displaces oxygen.
Yes.
Displaces oxygen, binds very tenaciously and sometimes irreversibly,
Yes.
So
it says we shouldn't smoke at all.
That is why actually people who smoke, one of the reasons why they will have this difficulty breathing
is
because this smoke, these substances have gone, they've taken over his blood, so that even when you're breathing, your body doesn't receive enough oxygen. It's still asking you for more.
Wow. Doctor, thank you so much. We still look forward to next Thursday. We're out of time. Want to thank everybody that's listening to the show. We've got the Hit Selector coming up with Nixon, and go nowhere. It can only be 91.2 Crooze FM. Great music, great friends. And thank you, Dr. Brian Besiga, for always being here every Thursday.
It begins with a spark,